Okay, this is a book review. The book is called Saving Sight by Dr. Andrew Lamb. He's an ophthalmologist. This is his picture on the cover. And, it's a good book. I would give it, out of a possible 10 stars, I'd give it 7 stars. Okay? Now, ophthalmologists nowadays, almost all of them are pretty smart. In general, to get into ophthalmology, it's like a synonym for AOA. That means you pretty much have to be in the top 10% of your class. So to be in the top 10% of a medical class, you got to be very disciplined, hardworking, and studious with a good memory. You don't have to be anything of a thinker, but you got to have a good memory. So you got to be pretty bright. What's good about the book? The information's good. It's accurate. He did ophthalmology residency. He also did a fellowship in retinal surgery. So that's sort of the cream of the crop amongst opthos, the ones who are ambitious enough to do a fellowship in retina. It's got good stories. My favorite parts were the story about cataract surgery and development of the Braille alphabet. I made separate videos on those topics. I like the fact he talked about the truth with the pioneers, how they would be harassed, sometimes fired from their jobs, have their funding taken away, denounced, their reputations ruined. This is what happens in medicine if you try to improve something. You get all these people attack you. The people who run medicine tend to be a bunch of frauds, a bunch of phony scumbags, and they get power and money from their authority and their position. So they hate it when a new person comes along and makes something better. Unless they get direct money from it, they usually hate it because they feel it's an embarrassment to themselves, or it's going to question their authority or diminish their authority in some way. You'd be amazed. In medicine, patients are like pieces of crap. That's all that stuff about patient care, that's all phony stuff for the public. In reality, it's make money for the bosses, okay? That's what it's really about. You better make money for the drug company. You better make money for whoever is the bean counter at your place, wherever it is, or you're out. And your outcomes don't matter. Everything's generic, standard of care. So I just tell you that because that's how it works. So somebody comes along and wants to improve something. In the short run, improvements often potentially lose money, or there's complications with the new surgery, or the new technique, or whatever, or they take more time. Anything that gets in the way of that bean counter's numbers is, there's going to be shit to pay. Okay, so they will ruin the guy's reputation. They would do terrible things to these guys. They would scream at them at meetings, call them quacks. Like Louis Braille, who invented, now he wasn't a doctor, but he invented the Braille alphabet. And he translated tons of books. I just did a video on this recently. They burned all his books. That's the kind of stuff you see. Nowadays, what they do is they just shadow ban you. Like me, I'm an example of, a genius level doctor who's done a whole bunch of innovations in medicine. And what's the appreciation I get? My books are all shadow banned. My videos are all shadow banned. It's better than being deleted, but it's still, I would like more than that, but I'm grateful at least for that. Like I said, it's better than being shadow banned, deleted, or bumped off. Okay, he has good summaries of surgical progress in ophthalmology. The book's easy to read and understand, so that's all good. Okay, now what's bad about the book? It's 100% totally conventional. This is the kind of book, and actually it's a good book to give like medical students when they rotate through ophtho. It's good for that. It'll tell them the truth. It'll tell them useful information. Okay, but he totally plays it safe, and he pretty much has to. I mean, if you want to rise in academic circles, if you want to be allowed in conventional publishing, you have to be a good boy, and he's a good boy. He doesn't ruffle any feathers. He doesn't insult anybody in power. He doesn't challenge the money system. There's no challenges here in any way. Okay, there's 0% information on nutrition, despite the fact that hypertension, diabetes, obesity, atherosclerosis are major causes of disease in the eye. Major, major, major. And he probably doesn't know anything about nutrition. Conventional doctors, they don't know anything about nutrition. Okay, they really don't. There's nothing controversial in the book. There's nothing surprising. There's almost zero personality. Again, he's a junior assistant professor level guy, so he doesn't want to do anything original. So like what I'm trying to say is anybody could have written this book. There's almost nothing unique about this author specifically writing the book. Very little. I mean, in comparison, you want to see a masterpiece book, a 10 out of 10 stars book, read Estrogen Generation by Dr. Anthony J. It's full of jokes, controversies, insights, surprises. And this book, there's a couple surprises talking about the pioneers, and I appreciated that. So it's still worth reading, and it's still a good book, but I'm just telling you, it's sort of like, kind of a generic book. Anyways, it was worth reading. I'm glad I read it. If you're interested in the eye, I think you find it helpful.